I don't know if you remember Shelley Berman. He was a comic of our era. He used to talk about getting on an airplane. And he said, you know, I always wanted to ask what I should do if it crashed, but I never did because I would rather be dead than look foolish. Don't do that when you visit the doctor. There may be things that you will be reticent about talking about. For example, you may take a plethora of pills over the counter and you feel badly about that. You got to tell them all the pills. There's a retirement village in Arizona called Sun City. Among the residents, it's known as Sin City. A lot of people, seniors, get sexually transmitted diseases. Now, these can be cured, but only if you tell the doctor what's going on. Another problem is that we get aches and pains, and we think there's nothing the doctor can do about that. It's just about getting old. Let the doctor decide that, particularly if you're losing weight. That's a real sign that something might be seriously wrong, and you don't say, well, it's just because I'm getting old that I'm losing weight. One piece of advice is to repeat the advice your doctor gives you. Repeat the advice your doctor gives you. 3 things. 1, it assures you that you understand what the doctor said. A lot of professionals, lawyers, doctors, accountants, whoever, talk in a certain jargon. And unless you try to repeat it in your own words, you won't know if you got it right. And if you get it wrong, that can have very bad consequences. Repeating the advice also has the advantage of you will tend to remember it better. The third advantage may be, less obvious, but by repeating the advice, you will understand or come to realize that you don't understand all of it. Doctors, like any expert, know a lot of things that are self-evident to them, but may not be self-evident to the patient. For example, you have a prescription with 2 pills, 2 different kinds of pills. You say, well, should I take these 2 pills together? And the physician may have never told you about that because it's a self-evident to the physician that of course you shouldn't, and anybody should know that. So if you repeat the advice, you will fill in gaps of your own understanding. One thing also when you are visiting a doctor is you have to sometimes press to make sure you're being heard. I remember a case where a criminal defendant was appearing before a judge, and he said, Your Honor, I would like to have a new lawyer. And the judge says, well, why is that? And the defendant said, well, my lawyer doesn't pay any attention to me. And the judge asked the lawyer, said, is that right? And the lawyer says, I'm sorry, I wasn't paying any attention to him. Now, when you see the doctor naturally will kind of take over and start asking questions. A survey, which I was kind of shocked to read, showed that doctors start asking questions within the first 18 seconds of the visit with the patient. There may be things that you want to tell the doctor that will not be triggered by any question that doctor asks. So sometimes you're going to have to steel yourself and say, I want to get what I want to get to say out before I am interrupted by my doctor. How about taking someone with you? Unless it's a simply routine matter, it's a very good idea to have someone drive you to the doctor. Now, maybe the physician won't want that person in the room during the examination, but you have a perfect right to have a person there when you start talking about treatment and what you should do. Having a third party there will help you remember what was said. That person will have a clear mind. You will have, particularly if it's a serious conversation, a lot of things on your mind, and you might be blocking information out. So it is essential to have someone with you. That person might become your advocate, may push for a referral, for example, or more paid medication. So it's a good idea to get someone to take you to anything other than maybe a routine doctor's examination. What about preparation? Just don't go to the doctor. Spend some time preparing. Everybody should have a list of all of their medications, including things that they buy over the counter. Have that with you. You should also make a list of the things you want to talk to the doctor about. Many times you'll get in there if you have 3 or 4 things to talk about and you'll forget number 4. If you have a list, that will prevent that from happening. You might want to do some preparation too by just going on the web and going to one of the many excellent websites that gives medical information, such as WebMD. You can learn about what you think you might have, you might learn about some questions you might have, and you'll just be a lot more informed. And most physicians I talk to like their patients to have done that kind of work because that facilitates a more deep and more understanding discourse. However, don't be convinced by actors who are playing doctors on TV that you have a disease or a condition that you never even knew you had and that you need this particular kind of drug to take care of it. Let the doctor, who's a real doctor and not playing a doctor on TV, make the diagnosis. Now, one thing, I've got some questions that you might want to ask your doctor to help your doctor make a more proper diagnosis. Say it's flu season and you wake up in the morning and you have a fever and you have aches and pains and a cough. What do you conclude? Well, you conclude that you have the flu too. You jump to that conclusion. Doctors do the same thing. They can jump to conclusions as well. A guy named Dr. Gupman wrote a very interesting book called How Doctors Think. And he says doctors indeed jump to conclusions. Often 1 in 10 diagnoses, he says, is a misdiagnosis. How can you as a patient prevent that from happening? 3 questions. Number 1, you can say, could this disease or what I'm suffering from be something else? And then I'll say, well, maybe, come to think of it, it could be X, not the flu. Second question is there anything in the symptoms I have and the tests that you ran that is inconsistent with the flu? And he or she might say, well, now that you mention it, your fever's a little bit strange, doesn't quite fit. The third question might be, could I have an additional disease or condition behind the flu? A lot of times people will present with one illness, but behind that is a more serious illness. So if you ask those 3 questions, could it be something else? Is there anything inconsistent with my symptoms? And third, could this be masking another disease? That will help your doctor avoid the human tendency that we all have, being human, to jump to conclusions. A couple more questions. A good friend of mine, who's a physician, recommends that you ask, have you considered that I might not want this treatment? Now, doctors, of course, are trained. They spend a lot of time learning how to treat diseases. Well, for an individual, maybe it might not be worth, the treatment might not be worth the possible cure. It might be expensive, it might be painful, it might be problematic. So one of the things you might want to talk to your doctor about, rather than simply accepting the treatment protocol, is to ask, well, maybe I don't want this. What are the pros? What are the cons? The final question is probably is not a great or is a great question, but one asked in kind of dire circumstances. Say you or a loved one is at the doctor's with a very serious illness. The question then would be, would it surprise you if I or Aunt Mary or whoever the patient is, would it surprise you if they were to die within 6 months, 12 months? Another series of books has indicated how reluctant physicians are to give really bad prognosis. They don't like to give bad news for a whole lot of reasons. As a patient, you're going to have to, under some circumstances, trigger that conversation. Because once you have a clear idea of where you are or where your loved one is, then you can take seriously end-of-life planning that you should be taking care of. So with that in mind, good luck at the doctor's office and good luck on your next flight.